Hi friends, I welcome you all for this session. In today's video, we will be learning about the ossification of common fetal bones and how they are helpful in the clinical fetal assessment. Thanks to Dr. Shrikant Chaudhary who has asked for this video. This picture serves as a visual guide for us to help in identifying the expected ossification centers that we commonly see in the fetus. Our next question will naturally be, will there be any variability in the appearances of this ossification center? The standard error of appearance of ossification center is estimated to be approximately plus or minus 1 week. This variability increases with gestation. That is, it is less in fetus of around 12 weeks of gestation than in fetus of around 23 weeks of gestation. Now, let's see which ossification centers are clinically important on ultrasound and how do we apply this information in our day-to-day practice. Cranial bone ossification should normally be visualized by 11 completed weeks of gestation. So if ossification is absent beyond this point, it serves as a reliable diagnostic sign of acrania. Femur and humerus are typically visualized by around 9 weeks of gestation, while tibia, fibula, and radius ulna become visible by around 10 weeks. An interesting developmental detail is that upper limb ossification tends to appear slightly earlier than that of lower limbs, usually by a margin of around approximately 2 days. Digits of hands and feet are seen from 11 weeks, whereas the metacarpals are seen from 12 weeks. So remember that all long bones are consistently visualized by 11 weeks of gestation. Carpal bones ossify only after birth and remain cartilaginous in utero. Among the tarsal bones, the calcaneum typically ossifies by 23 weeks and the talus by around 26 weeks. If these ossification centers are seen before 18 weeks for calcaneum or before 22 weeks for talus, that is 4 weeks ahead of their ossification time, then it may be a sign of premature ossification. The premature ossification may point towards chondrodysplasia punctata. Therefore, look for premature ossification in other places also, like vertebral body stippling and sacral stippling, and there can be of binders facies phenotype and short long bones. All this may point towards chondrodysplasia punctata. However, the etiology for chondrodysplasia punctata are multiple and it has to be evaluated accordingly. The next important clinical aspect is appearance of fetal epiphysis and their role in gestation age assessment. The distal femoral epiphysis typically appears after 32 weeks, proximal tibial epiphysis after 37 weeks, and proximal humeral epiphysis after 38 weeks. Their presence on ultrasound has high positive predictive value for assessing gestation age in late pregnancy. However, in cases of IUGR, these centers may appear delayed, limiting their reliability. That is why their presence is more informative than their absence when estimating the gestation age. Before going into the ossification of the fetal spine, let's look at the anatomy of a vertebra. Each vertebra consists of a vertebral body, two transverse processes connected to the body via pedicles, two laminae which extends from the transverse process and join at the midline to form spinous process. So the lamina is the key structure that connects the transverse process to the spinous process. Each vertebrae has typically three primary ossification centers, one for the vertebral body or centrum and one on each side of posterior neural arch. The posterior neural arch begins ossifying at the base of the transverse process. From there, ossification extends anteriorly into the pedicle and posteriorly into the laminae. It also progresses craniocaudally into articular process and laterally into the transverse process. since the hallmark of the spina bifida is the absence of the defect of posterior neural arch ossification. The ideal way to confirm spinal normality is to demonstrate continuous intact posterior ossification at all spinal levels during the ultrasound examination. The ossification of the vertebral body begins earliest in the lower thoracic and upper lumbar regions, and then it progresses in both the cranial and caudal direction, that is, a bidirectional pattern. In contrast, the ossification centers of posterior neural arch follow a uniform craniocaudal progression. This table shows the timing of ossification of both vertebral body and lamina across different spinal regions. The vertebral body ossifies uniformly between 12 to 13 weeks in cervical, thoracic, and lumbar regions. In contrast, the lamina ossifies later, around 18 to 19 weeks in cervical spine, 20 to 22 weeks in thoracic spine, and 22 to 24 weeks in lumbar spine. Only after 25 weeks there is consistently recognizable ossification of the arch in sacral region. Coming to the ossification of the sacral vertebra, it starts from craniocaudal direction. S1 is visible by ultrasound by approximately 11 weeks, and S2 by 14 weeks, S3 by 18 weeks, S4 by 21 weeks, and S5 by 24 weeks of gestation.